Welcome to the United States and to Albany, New York. With this video, we want to prepare you for your first visit to the doctor in the United States. This first appointment is called a Refugee Health Assessment. It usually takes place at St. Peter's Rensselaer Health Center. This appointment is a follow-up to the medical exam you had before coming to the United States. It is designed to review your health needs, check for any immediate health concerns, update missing vaccinations, and refer you to any special doctors if needed. In New York State, health screening for new refugee arrivals must be completed within 90 days. The Refugee Health Assessment is free for refugees. The doctor's office will use a professional interpreter who speaks your language so that you can communicate with the nurse and doctor. The Refugee Health Assessment consists of 2 appointments with the doctor. This video focuses on your first appointment. After your health assessment is complete, you will be able to choose your primary care physician. Your case manager will give you an appointment sheet listing the dates of your appointments. You will have 2 dates in 1 week that you need to go to the doctor, and you must attend both appointments. Your appointment sheet will list the time of your appointment and also the time you need to be at the USCRI offices to get a ride to the doctors. It is your responsibility to take the bus to the USCRI office and arrive on time. If you have a family member or friend who can drive you directly to the doctors, please tell your case manager. When you arrive at the health center, you'll need to check in with the receptionist. She'll ask you for your overseas medical records and vaccination records from your IOM bag and your health insurance card if you have one already. After the receptionist makes copies of these records, she will return them to you. She'll confirm your address and ask if you have a telephone number. Then she will ask you to sit in the waiting area until you are called for your appointment. A nurse will call your name and lead you to an exam room. The nurse will ask what language you speak and will use a telephone to call an interpreter. The nurse and the doctor will speak in English, and the interpreter on the other end of the telephone will listen and repeat that information to you in your language. You can then respond in your language, and what you say will be interpreted for the doctor and nurse in English. If there is anything you do not understand, it is always okay to ask a question. After the interpreter line is established, the nurse will ask a series of questions. Do not worry about answering personal questions. All of the information you give will be kept confidential. The nurse will ask your health history and living situation. You will also be asked if you smoke, or drink alcohol, or use recreational drugs. She will check your weight and your height and take your blood pressure. Adults and women over the age of 10 will be asked for a urine specimen. The nurse will hand a urine container to the patient, which you will take with you to the restroom down the hallway. After voiding urine into the cup, you should place it in the cabinet within the restroom wall. Urine screening test is needed to check for any abnormalities. Women will also be tested for pregnancy. Women who are pregnant should tell the nurse at the beginning of the visit. The nurse will also ask if you have any allergies. An allergy is an abnormal response of the immune system to certain foods like fish and nuts, the environment, medicine, or pets. Common symptoms of an allergic reaction include itchy, watery eyes, sneezing, itchy, runny nose, rashes, feeling tired or ill, or difficulty breathing. The nurse will ask if you take any medications. Please show the nurse all the medications you are currently taking in their original packages, even from other countries. The nurse will ask you if you have any health concerns or problems. This is your opportunity to tell the nurse about any problems or questions you have concerning your health, so that the doctor and the nurse can make sure you receive proper treatment. If you have any pain, you will be asked to state the level of pain on a scale of 1 to 10. 1 is the least painful, and 10 is the most. Vaccination. New York State immunization requirements apply to everyone. Therefore, it is important that this is taken care of as soon as you arrive in the United States. The nurse and doctor will review your vaccination records and determine what additional vaccines you may need at your first visit. The doctor will be coming in shortly to do your health exam. Before the examination, the doctor will explain what she will be doing. She might start by checking your eyes, your nose, your throat, or ears. During this entire time, you will have access to an interpreter on the telephone. You can discuss any immediate health concerns or pain or discomfort with the doctor at this time. If you have any questions or don't understand what you have to do, just ask. If you have any current health issues, please tell them to the doctor. After the examination is completed, the doctor will explain to you the need to place a PPD in your arm. What is a PPD? A PPD is a skin test to check your immune system response to the bacterium that causes tuberculosis. You must come back to the clinic in 2 or 3 days. Otherwise, you will need to repeat the test. The PPD test may be positive or negative. If the PPD read is positive when you return in 2 days, it doesn't mean that you have tuberculosis. It could mean that you have had exposure to tuberculosis at some point in the past. A nurse will give you a prescription for a chest X-ray. This chest X-ray is to rule out any active tuberculosis disease. Any refugee with a positive PPD read can expect to be notified by the Department of Health. They will require a follow-up visit. A nurse will give you a prescription for a small blood sample to be taken to determine your immunity to various diseases. Bring your prescription to have a blood sample taken to St. Peter's Hospital at 319 South Manning Boulevard, or on Thursday mornings from 8 to 9:30 at Rensselaer Health Center. You may also be given prescriptions for medicines the doctor deems necessary. These medicines may be obtained at any pharmacy, like the one in Price Chopper, Walgreens, CVS, or Rite Aid. Your first visit comes to an end. To sum up, it is very important to return for your PPD read in 2 to 3 days. Also, don't forget to drop off your stool specimen bottles. Things to do at home. These are the 2 containers you will be given to collect stool samples. Using the wooden stick provided, when you have a bowel movement, Scoop a small sample of stool and place in one container. On the next day, when you have a bowel movement, use the second wooden stick and scoop a small amount of stool and place in the second container. Seal and place the containers in the bag provided and bring with you on your second visit, 2 days after your initial visit. After your PPD read, you will be given an appointment card for your second visit. That will happen in 5 weeks. Congratulations, your health assessment has been completed. Now you are able to choose your primary care physician. Welcome and good luck.